Thank you, Elizabeth. Hello, everybody, to all colleagues and friends and people attending this webinar in the EURO-NMD episode number 2. So based on the genetics month for webinars related to EURO-NMD. So very happy to introduce Fernanda, so Dr. Fernanda Fortunato. She's working at my site, University Hospital in Ferrara. Fernanda is already a medical geneticist, and also she's completing the PhD here at the University of Ferrara. Probably many of you know already Fernanda for what she has done within the EURO-NMD, but of course, especially related to the CPMS activities and the training course and all the activities related to that. So obviously, this is our task since the Ferrara Hospital as a healthcare provider is, the recipient and the leader of the work package 4 within the new EURO-NMD multi-beneficiary grant, and therefore we are committed to implement the CPMS use, so this very important platform that the EU has established for rare diseases. So this is not only for our ERN, but of course it's transversal, is related to all European reference networks. So Fernanda has intensively worked on that, promoted all the educational activities, and also we have in mind also new modalities to interact with all our representatives and colleagues within EURO-NMD. Therefore, that's all, and the webinar of today, as the title you see here, basically will present you what CPMS are, how can we take advantage of the CPMS use within ERN in the full interest in order to implement, to increase the diagnostic capacity for our rare disease patients, focused of course on some genetic cases for the discussion, and perhaps also future possible uses of CPMS that we are proposing within the ERN. So hope you will find the webinar interesting. I'm completely sure Fernanda will do a great job as she is doing for the CPMS activities within our ERN. So thanks, and leave Fernanda. Thanks, Fernanda, and please go ahead with your presentation.
Good afternoon, everyone. Thank you very much for giving me the opportunity to lead this webinar on CPMS and its role in discussing complex clinical cases. I am Fernanda Fortunato from University Hospital of Ferrara. With Professor Ferlini, we are leading the work package 4, the work package dedicated to healthcare and CPMS. As you know, European reference networks offer a wide range of services, clinical services, including teleconsultation and support to healthcare providers with health solution and digital solution, non-clinical services, including clinical guidelines, registries, training, educational activities and dissemination of information, and research activities such as promoting clinical trials, biobank, patient registries, maximizing the use of ERN digital tools and clinical patient management system and e-health activities is a central part of ERN mission. Many of you probably already know CPMS. CPMS is a secure platform that aims to support ERNs in improving the diagnosis and treatment of rare or low complex diseases. And it's a secure software for sharing clinical data, including medical imaging. And healthcare professionals can use this platform to cooperate within the same ERN or across different ERNs. And the focus is first on diagnosis and treatment for patients by providing tools for collaboration, virtual consultation, and cross-border discussion. CPMS is especially important in genetic context, where decision-making process is often complex and uncertain. Interpreting on variants often require multidisciplinary advice. Evidence may be incomplete, evolving, or conflicting. CPMS allows structured discussion that make clinical reasoning transparent. Using also this platform can be improved the consistency across teams and centers. And finally, the platform provides the traceability essential for eventual follow-up, reclassification on variants, and audit. This slide illustrates the workflow of the old version of the platform called CPMS 1.0. Access in the old platform was restricted to ER users with a key requirement. Each user needed to obtain an EU login and had to be affiliated with one of the participating healthcare providers. Patient enrollment within CPMS could be carried out by any healthcare professional at the hospital. It was mandatory that patients had signed consent for care before they could be enrolled in the platform. And once the enrollment was completed, a consultation panel could be opened for that patients. It was possible to receive also an invitation as an expert, and the expert could contribute to the discussion by requesting additional patient data, scheduling meeting, or discussing with other panel members. At the end of the assessment, all members were required to record their contribution within the panel. They could also view and comment the other members' contribution. And finally, an outcome document summarized all the contribution was produced by the panel lead. To promote the use of the old version of the platform, the CPMS 1.0, a one-year Italian pilot project was developed thanks to a grant from Saretta. And the objective of the project was not only to seek diagnosis, care, and treatment advice, but also to create a sort of database of clinical, genetic, diagnostic, and therapeutic data, especially for some pivotal diseases. And the pilot project included a structured training course with several aims: promote the use of the platform among the Italian members of EURO-NMD, provide hands-on training to the use of the platform, and enable an independent use of the platform. And the project involved 13 healthcare professionals and lasted 4 months from September to December 2020. And the training course included 6 lessons per month, each lasting 2 hours, and was conducted remotely. 2 medical doctors, 1 medical geneticist and a neurologist, have been appointed for the project and trained by a CPMS expert through dedicated virtual sessions. And these medical doctors provide support to Italian healthcare providers through a main training course, but also dedicated webinar to follow the collection of data and enrollment of patients. The project also aimed to increase the awareness of the platform potential, strengthen the EURO-NMD network, and could serve as an example that be adopted and replicated in other countries and in other year ends. The project generated excellent results. By the end of the course, out of 102 consultation panels available on the platform, 87 were Italian. Differences in proficiency in using the system and in the number of patients available were reflected in the number of panels opened across different centers, ranging, as you can see in this slide, from 3 to 14 panels per center. At the end of the course, there was also a considerable difference in the number of panels created for each thematic areas. Most panels, as you can see, referred to muscle disease area, followed by genetics, then motor neuron disease, peripheral nerve diseases, and mitochondrial diseases. And this pilot course allowed us to greatly improve our experience with the CPMS and achieve great results. Through this training, healthcare professional became much more familiar with the platform and started seeing the platform as a powerful diagnostic tool. A total of 32 professionals took part in this course, and participants successfully opened their panels, practiced the enrolling patient, and the scheduled meeting. In particular, the video meeting function was considered a very important tool to design a diagnosis. And the course also strengthened the Italian ACP network, especially for the young members of the network who had the possibility to meet and to work with each other, also with experts. And so the case discussion were an opportunity for the younger member to learn and to improve their skills. At the same time, the training course highlighted some critical issues in the platform as reported by ACP. For example, Italian users face many technical difficulties as lack of clarity about the steps needed to obtain an EU login or to access to the platform, complexity in some section of the consultation form, as for example the genetic session, inconsistent mail notification, and limited access to the video meeting tool, probably due to specific issues related to the network internet security setting of each hospital. But the experience of the Italian pilot project included its added value, positive aspects, critical issues identified, and potential implementation that could facilitate the adoption of the platform has been described and documented in this paper produced by our group, which is shown in this slide. And so, as anticipated by Professor Ferlini, building on this experience of the Italian pilot project, our ERN received a grant in 2023 to support coordination, management, operation activity of the ERN. Within this project, several work packages, as you can see, have been designed, and the work package 4 is totally dedicated to healthcare and CPMS. So work package 4, led by the University Hospital of Ferrara, has several goals. This includes providing a virtual multidisciplinary advice for patients with rare neuromuscular diseases, implementing and expanding the use of the platform for cross-border consultation, contributing to development and testing of the new version of the platform, the CPMS 2.0, and also carrying out dissemination activities as position paper and white paper. To reach this task, we have planned several tasks. First, we are organizing virtual CPMS teaching course to help healthcare providers to become much more familiar with the platform. Another key task is the CPMS focus group called CPMS Days, where unusual and complex cases can be discussed along with questions related to genetic aspects, clinical or imaging peculiar aspects, or eligibility to orphan drugs. Other important tasks include a pilot reimbursement scheme to provide support to ERM members who enter in close discussion on CPMS. Other tasks include the development and testing of the new CPMS, the CPMS 2.0. We aim also to support the CPMS users through the CPMS desk function, and developing virtual guest centers to fill coverage gaps across the EU. Finally, we also aim to explore a possible way to for a possible interoperability between CPMS and patient registries. As you probably know, the old version of the CPMS, so the version of the CPMS we use, has recently been replaced by CPMS 2.0. This CPMS, this version is available on both desktop and now also on mobiles. It remains fully secure and GDPR compliant, but now combine all the core features of the previous version, so editing profile, entering patient data, uploading file, organizing meeting, and producing an outcome and reports with a more intuitive and user-friendly interface. There is even a test version available, and the link is provided below. I strongly recommend to use this test version because you can try it out by enter dummy patients, and so to explore all the functionalities of the new CPMS, the CPMS 2.0, in a very simple way, in a very comfortable way, without worrying about making mistakes. Sorry. Okay. Now, let me give you a quick overview of the CPMS 2.0 and its main features. Once you log in, you land on the home page of the CPMS, where you will see the main menu and the dashboard overview. On the left, you will find tabs for patient records, add new patient, meetings, supporting documents. The home page also shows your upcoming meetings and active discussion you are involved in. The patient records tab, the patient records tab shows patients you have enrolled and also patients whose records you have been invited to participate in. Keep in mind that you won't see personal data of patients unless you are the point of care specialist or lead for that case. Adding a new patient is a very simple process. Start with date of consent and then all the personal data of the patient, first name, last name, sex, date of birth, and nationality. And once next, give the patient a nickname or keep the nickname the system provides. Content templates and other useful documents can be found in the supporting document tabs, so you will find all it's important for you. Once the patient is enrolled, you can invite participants to discuss on your case and also uploading files to support the discussion. In detail, by clicking Add Participant, you can select, this is a very important feature now, because you can select experts from your ERN, but also from the other 24 years, or also guest clinicians. And the platform, this is another important feature, allows uploading most common files, documents, video, images, and even advanced imaging like diagnostics. This is very important for example, the imaging group. So all the participants have what they need to contribute. And during the discussion, you can exchange messages in the discussion windows. You can see this in the right part of my screen, like a chart, but you can also choose if the case is urgent or not. But if a live conversation is needed, you can also schedule a video meeting through the meeting tabs. And finally, when you feel the discussion is complete, you can close it by writing a conclusion and an outcome, summarize all the key points of your discussion. Finally, an outcome document is generated, confirming, as you can see in this example, and the patient's enrollment, the topic discussed, and the conclusion of the expert panel. Now, to show CPMS 2.0 in action, I will describe two real-life examples. In this case, I presented my patients, one patient with two previously undescribed variants in MST01 gene. And I described briefly this case in the discussion topic. And the main question for the experts I selected in the muscle disease area and mitochondrial disease area was which additional investigations to perform. And using the discussion windows, as you can see, experts in muscle and mitochondrial disease suggested specific tests to perform in my patients and share insights to guide the clinical decision. Or again, in the second case, a patient presented with a myopathic phenotype and 2 variants in Theta engine. Again, in chat-like discussion, I presented the case and I discussed it with experts from the muscle disease group. These experts suggested the relevant bibliography to help evaluate the phenotype, to better elucidate genotype-phenotype correlation, and recommended further investigation, in this case, a muscle MRI. And this example clearly show how CPMS allows rapid cross-border discussion among experts, supporting complex diagnostic process as a genetic process and clinical decision in a way that is very efficient and not time-consuming. So, to summarize how TPMS fit into daily clinical practice, what it brings to the table, I summarize this point in these slides. When to use it? CPMS is especially useful for cases with uncertain or conflicting evidence as variant of uncertain significance, for clinical relevant or high impact decision, or when multidisciplinary discussion are needed, or for eventual re-evaluation of cases previously described. Who to involve? The discussion could include all the experts you think are very important for your case, as clinical geneticists, referring clinician, laboratory specialists, or other experts. And how it fits into the workflow. The first thing you have to do is to identify your case, to obtain the consent to enroll the patient in the platform, and then you can open a discussion on CPMS 2.0 and collect all the asynchronous contribution from the team of experts you selected, and finally shared and collect a documented final decision. About time commitment, case setup is quick. You can collect input and or comment other cases at convenience times, and initial meetings are needed only if required. What you get at the end, you obtain a shared reasoned clinical decision, and also you have into the platform a traceable discussion history that could be very important also for reference, for follow-up and future reviews. And it's important, I think, that CPMS does not add extra steps to clinical work, but it provides a structure to steps that already exist. As anticipated, to support the uptake and the adoption of the CPMS 2.0 across the network, the Work Package 4 team organized a dedicated series of virtual CPMS teaching courses called TPMS workshops for clinicians and assistants. The objectives of this short hands-on training were to promote the use of CPMS, to allow a navigation for user of the platform with the confidence, to create and manage discussion efficiently, and share information, patient information securely across borders. The first round of TPMS training session was organized by the University Hospital of Ferrara last year. Each webinar combined a live step-by-step demonstration of essential CPMS 2.0 features, such as creating a case, uploading clinical documents, organize a meeting, but also dedicated time was also reserved for questions from participants or to address critical issues. Another round of training is currently in progress, and here at the bottom right you can see the upcoming dates. In addition to the training courses, the Work Package 4 team introduced also CPMS focus group called CPMS Date that are structured, thematic, event-based case discussion designed to deepen some aspects of neuromuscular diseases. Instead of addressing singular cases, CPMS Days bring together multiple cases under a unified team. moderated by guest experts and open to observers for educational purposes. And each CPMS day is preceded by a target call for cases, which requires the pre-upload of all relevant clinical information in the CPMS. To date, 3 CPMS have already been organized, one by the University Hospital of Ferrara, one on mitochondrial myopathies with 3 cases presented and 2 experts invited, one on distal myopathies with 2 cases presented and 2 experts invited, and the last one, peripheral myopathies, with 4 cases presented and 2 guests invited. And so it's important to underline that the CPMS days are linked to pilot reimbursement scheme with financial support provided only for cases presented during CPMS days and also closed on the platform. But for better understanding on how the training was received and on how the platform was being used in practice, the Work Package 4 team launched a survey called CPMS Monitoring Process in September 2025. 31 healthcare providers responded, providing an important feedback. As shown in the pie chart, the platform has been used by both clinicians and researchers. However, you can see here that many of clinicians and researchers currently perform multidisciplinary discussion, demonstrating that probably once or twice time per month, showing that CPMS can support regular and multidisciplinary discussion during clinical practice. And unfortunately, more than 50% of the participants don't use regularly CPMS. This finding is also confirmed by the fact that only few centers enroll more than 5 patients during the last years. And regarding the type of issues more frequently discussed, you can see that diagnosis remains the primary focus, while discussion of variants of uncertain significance are still relatively rare. Moreover, the creation of case discussion panel was considered the most useful functionalities and features of the platform. This is very important because when asked about the main challenge in preventing regular use of the platform, responses indicate lack of available time in already busy clinical schedules. So, despite strong interest in the platform, many clinicians found very difficult to allocate time for non-urgent CPMS activities. Finally, feedback on CPMS days collected through the same survey show that more than 50% of participants identify more focus groups, so more CPMS days, as a priority activity to implement the use of the platform across the network. And we are very happy for this comment. In fact, we are organizing other CPMS days. It must be emphasized that CPMS 2.0 became fully operational only in December 2024, following the completion of data migration from the legacy system. In line with the European Commission guidance, use of the platform during the transition period, so between October 2023 and November 2024, the use of the platform was restricted to urgent consultation cases only. Hence, all non-urgent Work Package 4 activities were deferred until the new platform was fully available. Despite this reduced time frame of only 12 months, so 1 year, engagement among participants was high because in this year, during the last year, we had 64 new users with 38 clinical panels opened and 51 new patients added into the system for cross-border consultation. And this demonstrates that targeted measures as pilot reimbursement scheme, training courses, and user-driven adjustment could address the main barrier to the adoption of the platform, which was limited clinical time, and could facilitate the adoption of the platform. So to wrap up, CPMS and to summarize, CPMS is a key resource for both clinicians and patients and could really improve the diagnosis and the management of rare disease across Europe. From our experience with the CPMS 1.0 of the last 7 years, it's clear that training and continuous support are essential to allow an effective adoption and use of the platform. With the launch of the CPMS 2.0 and dedicated project and initiative, we aim to increase and to maximize the use of this very important and powerful diagnostic tool. We also aim to organize other activities to boost the use of the platform as CPMS marathons, so yearly fully educational data sharing events. We are also organize CPMS MBS, so dedicated forum for genetic newborn screening results with a particular focus on variants of uncertain significance that could be identified during genetic newborn screening programs. And also we aim to improve inter-ERN collaboration to enhance communication and data sharing. And I would like to conclude by highlighting that CPMS is not just a platform for discussing cases, it's a space where rare disease becomes accessible, helping clinicians, researchers to make informed decisions and improving collaboration across borders. For any further information, please feel free to contact me. You can see here my email, also Sofia Ferrari, our data manager. We will be more than happy to help you, to assist you in all the process related to CPMS. And thank you very much for your attention.
Excellent. Thank you very much, Fernanda. I'm checking in the chat if there are some questions coming. All right. But of course, we are just a few, so well, not a few, but 27 attending persons. So if you like to just jump in, have your question directly to Fernanda, you are welcome. Okay, let's see. Okay, there is a question from Katarzyna Kupidura Public. Is the service also available to patients? Fernanda?
No, the system allows only clinicians, researchers, or affiliated to one of the healthcare providers of the network. Now the CPMS 2.0 is also open to guest clinicians, so guest clinicians from other hospitals non-affiliated to ERN, but not for patients. But if you are a patient, you have any question or any case that could be presented in CPMS, you can ask to your clinician and we can help you.
Yeah, thank you, Fernanda. Yes, the CPMS basically are truly is a platform to for data sharing among clinicians. So is a clinical instrument. So this is why it's fully dedicated to professionals and not for patients. So, okay. Second question from Yuri Makanov. Will patients advocacy group be engaged as well in the system? Engaged as well in the system. I may try also, Fernanda, then you can also add something if you like. Well, the CPMS digital platform that was fully designed by you. So basically it's a tool. And the tool was basically made available for ERN professionals. So obviously, in the process of design, all ERNs have participated. So for sure, the inputs coming from patients association and advocacy may have played a role in just underlining which might be the relevant issues that should be included in the CPMS. Not sure this is the correct answer, but involved in the system, not clear to me if about this question, but again, we are not building on CPMS. This is a tool already designed and set up by the European Union for the ERNs. So there is not too much that we can do. Indeed, as Fernanda has underlined, we are now using the CPMS 2.0 version, which is much better. It was facilitated in terms of access, in terms of usage. So that's the point. But obviously, for any suggestions, any points that you may like to discuss or to also suggest eventually to be considered for the future CPMS version, because I'm sure there will be more than the 2.0. Your suggestions from patients associations are very welcome. And Fernanda, would you like to add something to this
Fine,
question?
okay.
Okay. So therefore, the institution has to be registered first before clinician can register. Can I check if my ACP is registered? You know better than me, Fernanda.
Okay. The first step is to be checked if your ACP is a part of a European reference network. This is the first step. If your ACP is a part of the network, you have to require a EU login, and then with an EU login you can access to the platform. On the website, I don't know if your hospital is in the European Reference Network of Neuromuscular Disease. On our website, we have a lot of video that describes very well the steps.
Excellent, thank you.
And the other thing is if your hospital is not affiliated to ERN, you can access to the CPMS now, and this is a new feature of the platform as a guest clinician.
Great, thank you. So I have also a chat webinar, so that's another session, but it's fine. There is a question for genetics from Mari Akmerian. Regarding genetic testing, which file is preferable? So VCF, BAM, or FASTQ? I can reply, Fernanda, if you like.
Yes.
So we are still organizing this genetics webinar, so dedicated to sharing genetic data. Of course, not certainly BAM file or VCF. We will decide shortly, of course, let you know. It could be that we may share FASTQ files or even raw data, which is probably much preferable in terms of data sharing for genetic testing. Not sure if I answered correctly. Okay, let's see if any other. Okay, well, you are welcome. Okay, other questions or just jump? Okay, right.
On the website, there are also dates from the future trainings for the future workshops. So we recommend follow this workshop because they are very useful to log in into the platform and to use it. So you can check it.
Yeah, we encourage, of course, all the ERN members to use a CPMS because, yeah, obviously at the beginning, you may need some time to familiarize with the system, but indeed this new version, so 2.0, is much more handleable and manageable than the previous one, and also we encouraged you all to participate to the training session and focus group we are organizing within the ERN. So please try because they are very interesting. Okay, and Elizabeth, thanks for the link for the workshop. Thank you for getting that. Okay. So if no other burning questions are coming, Elizabeth?
Yes.
I don't see nothing else. Perhaps we can also close the webinar.
Yes, of course.
Yeah, and therefore, yeah, we thank you all for your participation. And CPMS is a very versatile platform and should be experienced as in a way to be appreciated. This is our suggestion. So please do not hesitate to join the workshop, to join the focus group, and you will be surprised about how CPMS can be useful and interesting also to brainstorming and to share patients' data, also solve or presenting or also solve complex cases. So please just join. And Fernanda, if you'd like to say some last words, please.
Thank you very much for your participation, and please feel free to contact me if you have any doubt or any problems with the CPMS. Thank you very much.
Thank you, everybody. Thank you, Elizabeth.
Thank you, Alessandra.
Of course, EURO-NMD coordination for having, plan and schedule these very interesting webinars. Thank you.
Of course. Thank you, Fernanda.
Thank you.
Bye.
Thank you, Elizabeth. Bye.
Bye.
Bye.